Thank you for joining us in another edition of our Health Talk series. Today, in the Women's Health series, we are going to continue talking about the situation called ultrasound in pregnancy. What is an ultrasound? An ultrasound machine is a machine that uses high level of sound waves to diagnose a condition. The high level of sound waves are used and are projected on a monitor on the machine. It is used to diagnose conditions in our bodies that we cannot see inside the body. But in pregnancy, it's not only used to diagnose problems, but it's also used to monitor the situation, the normal situation in the pregnancy. So what are the normal situations that we can use an ultrasound scan to do? First, we can find the baby's size, we can find the baby's expected date of delivery. We can also estimate the baby's position. How is it lying? Is it transverse, oblique, or breech? These are some of the normal situations that we can use ultrasound in pregnancy. In abnormal situations, we can use ultrasound machine to diagnose ectopic pregnancy, for example, an ectopic pregnancy or pregnancy outside your womb, that is behind the womb or in front of the womb. We can also use it to diagnose a molar gestation. A molar pregnancy is a cancerous pregnancy that arises from an unfertilized egg that has implanted in your womb. We can also use it to diagnose a condition called placenta previa, an abnormal sighting of the placenta. So these are some of the abnormal situations that we can use an ultrasound machine to do. So if you are expecting an ultrasound scan when you are pregnant, what should you expect? First, there is no need to prepare for anything. The only thing that you may need is to have a full bladder. Drink a lot of water before the procedure. Another thing that they may need is for you to wear light clothing, because you need to expose your abdomen very well, from the breastbone down to the pubic hair. These are the only exposures that are needed. So you will be expected in the ultrasound room to lie down flat on a couch, and the sonographer will apply a gel on your tummy. Be prepared to feel something like a cold touch, because the jelly will most likely be cold. So he will use the probe to scan the abdomen and project it on a monitor. You can ask to check or to look at what he is looking at, so you can go through them together. So after the scan, you can expect to get a tissue paper to clean yourself up, and then to get a printed copy of what has been scanned. Usually in private settings they give you the scan, while in a hospital that you do follow up with, they put it in your records. These are some of the expectations during an ultrasound scan. If the doctor or the sonographer, as the case may be, finds something abnormal, he is going to discuss it with you. Most abnormalities that are found, as we talked about earlier, include pregnancy outside the uterus, for example, or a molar gestation, which can be evacuated using an aspiration or vacuum aspiration machine. An ectopic pregnancy needs an urgent laparotomy, that is an urgent surgery to remove it. Sometimes an ultrasound scanning can diagnose a condition called abnormal structural abnormalities, in the pregnancy. So in this situation, you have the option of whether to continue the pregnancy or discuss with your doctor to abort the condition. So these are some of the things to expect during an ultrasound. There is nothing difficult about having an ultrasound scan. Thank you for joining us, and see you next time.